Today we've got Sibi Walter joining from New Zealand, so the other side of the planet, and thank you very much for joining. Sibi is a researcher at the University of Canterbury and has a really good background not only in cricket but specifically in shoulder research around cricket. So all we're going to do today is Sibi is basically going to tell us who he is, what his research is around, and then we can hopefully learn some stuff that we can take away to impact our games. So Sibi, do you want to just introduce yourself and let everyone know first of all who you are and what your background is?
Sure, thanks Sam, thanks for the invite, happy to be here. So my full name is Sibi Boycott Walter, and I'm sure if you play cricket you should know who Boycott is, Geoffrey Boycott. My dad was a big fan of cricket, my dad was a sportsman himself, so that's why I got that middle name.
That's a cool name.
Yeah, but when you're writing research papers, it's good to have a short name. So I just put Sibi first name and last name. I skipped the middle name. I played cricket. I played cricket in high school, and then played in a club as well, played for an academy. And then I wanted to study something closely related to sport and sports science, and I did my undergrad in physiotherapy. And again, I worked with cricketers for 2 years in Chennai Super Kings, home of Chennai Super Kings in South India, because that's where my home is, that's where I'm originally from. And after doing my 2 years of field work, I decided that I wanted to upskill myself, and I went to Sweden and I studied in Lund University, a Master of Sports Science. And after that I worked in Sweden, I worked in Denmark, and then after 2 years again, after my Masters, I decided that I want to go into an academic route, and that's when I chose to do a PhD in University of Canterbury, that's in New Zealand, Christchurch, Canterbury. So you could say I got 3 degrees from 3 different countries, from 3 different universities, and they all have been sport related: physiotherapy, injury prevention, sports medicine related, so they all tie with each other. My doctoral thesis was titled Shoulder Injuries for Fast Bowlers in New Zealand Cricket. So I did an injury surveillance in cricket among all the first class fast bowlers, domestic and national level, tried to find what might be the etiology or cause of shoulder injuries. And then I try to find out what is the time loss, how many matches and how many training duration is lost because of shoulder injuries. That was one of the studies that I did. And then I try to find out if shoulder pain causes any adaptations in the shoulder, or do the adaptations in the shoulder cause shoulder pain? What is the relationship this way and that way? So that was another study. And then another study that I did when I was doing my doctoral was to come up with an exercise program which is quite multi-planar, because if you take a dumbbell exercise, or if you take a barbell exercise, or even if you take a band exercise like paraband exercise, most of these are in a single plane. Either you will do it in a frontal plane or a sagittal plane. But when you look at the throwing mechanics itself, how the shoulder functions, and then if you look at the bowling mechanics itself, the shoulder is loaded in different planes. So it's a multi-planar movement occurring at the same time. And that is why I came up with a resistance program using Indian club bells. So Indian club bells are club bells which are shaped like a juggling pin, but then they have a weight at the end. So you can do those exercises in multiple planes when you do them. And usually when we work on the shoulder, we don't want to load the shoulder, especially the stabilizing muscles, using heavy weights. But the Indian club bells are 1 kg or 2 kg at the max. And so you can use resistance in multiple planes and then still load the muscle appropriately. So that is another study. That was another final study of it. So my doctoral study was looking at shoulder injuries, the cause, the injury rates, and then how to devise an injury prevention program. So that is what I've done. And I still continue to coach cricket, and I've been involved with the Premier Women's Cricket Club for the past 5 years as a strength and conditioning coach. And I've been teaching and researching at the University of Canterbury for the past 10 years now. So I do a little bit of skills coaching as well. So my research that I do, the coaching that I do, and the teaching that I do, everything ties in together. So I like to see what happens in the field and then what the literature says, combine together, come up with a new method.
Awesome. What I'm just going to do, Sibi, is share my screen for anyone who is unaware of what planes of movement are. so they can get that picture in their mind. But yeah, by planes of movement, this is all we mean. Sagittal plane is stuff that you're doing where you go straight forward. Frontal plane is stuff that you do when you go to the side. This is probably a better one actually. And then transverse plane is when you're doing stuff that's rotational.
Yeah.
So
just on that image itself, when you think about like a bowling action, you can see it moves from a sagittal plane, and then it goes to a frontal plane, and then it finishes with a transverse plane. Similarly, throwing as well. So all three planes are involved in just one action. Whereas when we do exercise in the gym, we don't use all three planes at the same time.
Yeah, that's a really good point.
With Indian club bells, I know there's lots of good practitioners who recommend them.
Yeah.
But we got to be a bit more careful when it comes to cricket application, because with the club bells itself, just like any resistance training, there are different weight categories. They sometimes start with 1 kg, go all the way up to 20 kgs.
Yeah.
And we got to understand that the object that we are trying to throw is only a few grams.
Yeah.
So we don't want to load the shoulder too much where it needs a lot of recovery period.
Mm-hmm.
So trying to keep the weight minimal, but at the same time controlling the movement is a smart way of strengthening those small muscles.
Yeah, awesome. Have you seen the name that I call it is I don't know why it's a Brazilian rotator cuff flow, but that's where I've got it from, and it's an exercise where you have a dumbbell and you bring it up here, turn up there, round the back and over the top. Is that something you've seen and used?
Yeah, that's similar, but usually they start from here, go this way, and then bring it out. So it's more like here we do an internal rotation, and then the opposite would be external rotation. So internal rotation and then external rotation. So you can incorporate both of them as well.
Yeah. Awesome. So I think first of all, it should be pretty obvious to everyone watching how much experience Sibi has in this field, and also just kind of focusing on one thing means we are listening to an expert. So the bits that I'm really interested in, and I've obviously already got carried away a little bit and gone off on little tangents, but if we focus on, I'm really interested in that study where you were saying about, does the adaptation cause the pain or the other way around? Do you want to just explain that one and what you found in a bit more? And why I'm also really interested in that is with fast bowlers, they obviously stress fractures in the lower back are a big risk and a big injury, and what the research has found around that is on L4 and L5, so in the lumbar spine. So if you're a right hand bowler, you actually get a site-specific adaptation on the left-hand side. So essentially the left-hand side of the spine is stronger. It has a higher bone mineral density than the right-hand side, but that is still the side that gets injured and gets the stress fracture, even though it has that adaptation. So it'll be really interesting to see if there's similar things in and around the shoulder. I imagine so. But yeah, take it away.
Yeah. So with the shoulder, so when we look at cricket, right? If you look at the most injury-prone body parts, definitely the back is number one.
Mm-hmm.
Following the back, you have wrist and hand injuries. Yeah. The difference over here is when we look at the back, it is mostly overuse related, workload related. So it is an overuse related injury. Whereas when we look at the wrist and the hand, it's mainly due to contact. It is mainly due to acute. So either it could be catching the ball or it could be landing on your palm. So it's two different types of injuries, but they both are the most common ones. And regardless of what playing level you are in, whether you might be elite, professional, or academy, or high school, or club level, the back, the wrist, and the hand are number one and number two.
Yeah.
Okay. Now, if you take the third position is usually contested between the shoulder and the knee, but it's a little bit different over here. So you can say shoulder is one area, whereas when you look at the lower limb, you could say it's a combination of thigh injuries, which could be more muscle related, or it could be knee injuries, which could be more related to the ligaments and the tendons.
Yeah.
Okay. But we'll just talk about the shoulder because that's what it is all about, right? So the shoulder, when we look at the injury of the shoulder, we have two types of injuries. One is called as a time loss injury, and then the second one is called as a non-time loss injury. So time loss injury is where because of pain, because of injury, you have to miss training, but you have to miss a match. And then non-time loss, as the name implies,
Yeah.
there is an injury, there is some pain, but you're not missing any games, not missing any trainings. Now,
Which I
as
think
said,
is extremely common in a lot of amateur athletes, isn't it?
Yeah. And what is surprising is that even though the shoulder, if you look at different studies done in the UK, done in Australia, done in South Africa, done in New Zealand, what we find is the shoulder is the most commonly injured body part, and it will be either ranking third or ranking fifth, over that. But what's interesting is, even though there is a high prevalence of shoulder injuries, when you look at time loss, it is only 3.8 or 2.8 injuries per 100 players per season. So that's time loss. But whereas when you look at non-time loss, we are talking about anywhere between 25 to 36 shoulder injuries per season. Okay? So that means there is high incidence of shoulder injuries, but those shoulder injuries are not causing a player to miss training or matches.
Yeah.
So that means players choose to, the pain, when you look at the pain scale, you can rate anywhere between 1 to 10, but usually the pain scale, we are looking at around 4, 5 or 6. So it's tolerable. So they can play with the pain. And what tends to happen is when someone has shoulder pain, the fielding position, right? They don't put them in the inner circle, they put them along the boundary. So there is not much of a load on the shoulder. You don't have to explosively pick up the ball and throw it immediately. So so because of what is happening here, let's say if you have a hamstring injury, you pull a muscle, immediately you'll start seeing them limp, and then you got to take them out.
Yeah.
So that the seriousness of the injury, the time lost, makes us give immediate attention to other body parts. In the shoulder, because the pain scale is not so high, even if a small niggle is there, if it's a mild nagging pain, it gets ignored. So when it comes to a pain where they're complaining, it's around 8 or 9, that's usually almost a month or 2 from the initial point of the injury. So we don't know for sure if the pain leads into the soft tissue changes, or if the soft tissue changes leads into unbearable pain. So it is, unlike other body parts, the shoulder is a bit complex when it comes to diagnosing it. There are several soft tissues which get adapted within the short period of time. You can talk about wasting of the muscle, we can talk about lack of strength, we can talk about the shoulder becoming more unstable, we can talk about inflammation of the tendon. So all these things happen, but none of them we can't isolate and say this is the primary cause for the shoulder pain, because a player continues to play with the pain.
Yeah.
So one of the most important advice I would say for players as well as for coaches is that when you have a shoulder niggle or some sort of pain, it's good to have it checked right away. Just don't ignore it and don't play with pain. It's always good to check it, because the shoulder is very important for a cricketer, and especially it's mostly the dominant shoulders. And it's very important, whether you're a batter, whether you're a wicket keeper, whether you're a fielder, whether you're a bowler. Bowling, it could be spin or pace, doesn't matter. The shoulder is very important. So you got to take care of the shoulder. Yeah.
Awesome. Let's say, so obviously you've said if someone is feeling pain, go and get it checked. What is there anything else? So let's say you go and get it checked and you don't need to stop playing. So it's not a time loss injury. What is the process going to be for that player to get to a point where they can keep playing, but in a few weeks or a few months, they're going to be hopefully not playing in pain and throwing and bowling pain-free?
Yeah. So we have come up with something which is called as Cricket First 11 for shoulder health. Okay. That's something which we're going to be publishing in the Cricket Medicine book, which is going to be published next year.
Awesome.
A few things, the first thing would be you got to throw regularly, because throwing itself is a loaded activity that you place on the shoulder. So at the start of a preseason, let's say if it's a field-based session, usually you tend to have a throwing session in the first week or the second week. Now, the first 3 weeks, or at least first 3 to 4 weeks, you don't throw hard. Yeah. So you focus on the accuracy, you focus on the throwing distance, which is very important. So the closer you are to the stumps, and you just focus on accuracy, not at the force applied, not at the intensity, is quite important. So slowly build up that intensity over a period of 2 weeks or 3 weeks or 4 weeks. So by the end of 4 weeks, that is when you should actually throw at full intensity. I mean, think of it, if you're going to a gym and if you're starting to lift weights for the first time after a break, in order to hit your maximum, you won't do it in the first week or the second week. You might do it in the third week, or probably you might do it in the fourth week, right? Because you want to give enough time for the muscle and the soft tissue to adapt. So similar to that, that's one thing that coaches and players need to understand when it comes to shoulder health, is that start off a preseason, don't throw full effort, don't do max effort. All right. Second thing is, even in the 3 to 4 weeks, if you're missing sessions, and then if you're going to throw at max intensity, you earn the right to throw hard. So if you're fully confident that you've loaded your muscle properly, and then if you're happy with it, then that's when you go and throw max. If you feel like you're still not there, it's not advisable to do it. All right. And then when you're throwing, let's say if you're going to have a fielding throwing session, not every throw needs to be at max intensity. So even for throwing, you can start with a warm-up, start with 2 meters, start with 5 meters, go to 10 meters, and then increase the distance, because as you increase the distance, your intensity also increases. So plan your throwing even within a throwing session itself. Okay. And then, unlike baseball pitches, in cricket, when it comes to throwing, a lot of emphasis is not placed on the lower limbs. How you position your feet, how you position your hip, how you position your shoulder. So when you look at baseball training academies and pitching academies, they usually teach that. They usually teach you how to stand, how to position yourself, where your feet must be placed before you can actually go max effort, right? So you do this, all right. First, you get the lower body mechanics right before you go to the upper body mechanics. So even in cricket, we need to teach that one. We need to teach how to use the lower body to generate force, and how can we tap into the kinetic chain. Because a lot of times when you don't have the kinetic chain, the force production from the lower limb moving all the way to the upper limb, you don't use your lower limb, you only throw with your shoulders, and therefore to reach the distance, you put more effort on your shoulder muscles. Whereas if you use the kinetic chain from your lower limb, the transfer of force actually helps you reach the distance. Just like when you look at a javelin throw or a shot put, for example, all the force is produced, right? So that is something that we need to teach athletes as well, or cricketers, how to use the lower body to generate force.
Which then, is just on that, I think you see top athletes throwing the ball really hard, but it looks effortless, and that's why, because if you're using the whole body and you're using the kinetic chain efficiently, then that power does look effortless, whereas if you're not using the lower body, you're not setting that base, you're not rotating your hips, you're collapsing through your core and you're leaning over and you're almost having to force it, that's when the injuries do happen.
And that thing could be observed not only in throwing but in bowling as well. The same thing, the transfer of momentum from the lower limb to the upper limb. And then the next thing, what I would suggest, the next thing in the shoulder first 11 would be focusing on shoulder strength exercises, okay? And then the emphasis should be mainly on external rotation.
Okay,
In one of our study, we found that even if you don't involve in any strength training exercises during the playing season, your internal rotators get stronger.
Really?
Yeah. Because the thing is, you throw and you're engaging your internal rotators. You throw and you throw and you throw during the season, so your internal rotators get stronger and stronger. Whereas your external rotators either remain the same or they go down in strength. And this is supported by a lot of handball related studies where they found that just strengthening your external rotators will minimize shoulder injury risk. So just working on external rotator exercises, during the season and during the pre-season. You don't have to worry about internal rotators because when you throw and when you bowl, you are using the internal rotators more.
Yeah.
Okay, because anytime you release the ball or anytime you throw, you're more explosive on the internal rotation part of it. So strengthen your external rotators. Another reason for that is when we look at the rotator cuff muscles, we have the subscapularis, which is a muscle which is inside the scapula. So that's why it's called as a subscapula, right? Because it is below the scapula. Now the subscapularis, when you look at the size of the muscle, it's a large muscle and it is an internal rotator. It rotates the shoulder inside.
Yeah.
Okay. And then when you look at the external rotators are the infraspinatus and the teres minor.
Yeah.
And they are very small muscles in comparison to the internal rotators. Yeah?
Yeah.
So by default, the anatomy of the human body itself is in such a way that you will produce more force internally, whereas you can only produce less force externally. Okay? So two things over here. One is the anatomy says that your external rotators are weaker. Two, the demand of the sport itself makes your internal rotator more stronger.
Yeah.
Okay. So that is why I would suggest focus specifically strengthening your external rotators. And another thing what you might observe is a lot of cricket players do external rotator cuff exercises. But the thing is the load, the repetition is not usually monitored. Usually they'll be like, oh yeah, I'm going to do 15 of this, I'm going to do 15 of this, I'm done, and I'm going to do warm-up. But you take any exercise program, every exercise program needs intensity, volume, frequency, right? Yeah, and those things need to be monitored. We need to place a slightly higher load and it has to be controlled and it has to have a more focus on the eccentric component of it. So eccentric loading of your external rotators is very important to strengthen the external rotators.
Yeah.
Yeah.
What would be your go-to exercise or exercises for that?
Yeah. So as I said, if you have access to a club bell, you can do using a club bell. Otherwise, if you're using a dumbbell or if you're using a TheraBand, what I would suggest you to do is to actually stabilize your shoulder at 90 degrees of external rotation and then explosive and controlled. Explosive. Controlled.
And the band will be attached in front of you?
Yeah. So you can attach the band right in front of you if you want to do that. Otherwise, if it's pivoted below, you can do that as well. Yeah,
and you just maybe use a bench to pop your elbow on.
Yeah, what I usually do is I have the barbell on the rack, and then the barbell is positioned in such a way so that the barbell is right over here, so it's well supported. Because what would happen is if you don't have a support, the movement is not isolated. You have a lot of compensatory movements happening. So as long as you isolate it and then do external, controlled internal.
Yeah.
Explosive external and then controlled internal. That is very good. And do it bilaterally.
Yeah, love it.
And because we are talking about shoulder mechanics and shoulder strength, it is good to do the same exercise in the scapular plane.
Yeah.
Yeah. So you got 90 degrees of abduction, but you got the scapular plane which is at 30 degrees.
Yeah.
Which is not all the way to the front, but at 30 degrees. And you got to do that as well.
Okay, cool.
Yeah, you got to do the same.
Yeah, and then the band would be on an angle across you, right?
Yeah, the band would be on an angle. Otherwise, you can use a dumbbell as well at an angle. Very light dumbbells. Don't go too heavy, because in the shoulder, yes, you need to be able to create explosive power, and at the same time, you should be able to do it repetitively as well. So it is a mix of high load, high force production, but at the same time, you need to have endurance as well. So movements have to be repetitive as well. Keep it progressive, monitor what load you're lifting, monitor what resistance you're applying in the first week to the fourth week, and slowly progress on that one.
Yeah.
So that's very important for it. Yeah, so that's one of the things. And monitoring throwing workloads, monitoring throwing workloads and monitoring bowling workloads is probably one of the most important things. And as I said, during the pre-season, what you do, during the first 2 weeks of your tournament season, what you do is very important. Just like the example of how we go to a gym, and then if we're going to lift weight, we are loading our soft tissues.
Yeah.
So when we load our soft tissues, we don't go max intensity at day one. We usually take 3 weeks or something to lift our max, right? So in a similar way, monitoring what you do, monitoring how much you do. So that is like keeping account of how many balls you throw in a session, keeping account of how many balls you bowl in a session, because those two are workload on the shoulder. I mean, you could be a spin bowler, and when you bowl, you are using your shoulder. But at the same time, if you're going for a throwing session, that's two workloads on the same soft tissue.
Yeah.
So how many balls in a session, and then how many sessions in a week, those two needs to be monitored, and then progressively plan it. And depending on the age group, I mean, ECB have got their own guidelines, bowling recommendations based on the ages. Australia has got its recommendations, New Zealand got its most of them are aligning with each other. So following its recommendations is very important. And it is good not to throw 3 days in a row. Yeah.
Yeah.
If there is a match, and if it's a 2-day, you don't have a choice, but you got to be there for 2 days.
Yeah.
But again, planning a training throwing session just the day before or the day after is definitely not. So don't throw 3 days in a row. If you can alternate, that is very good. But if there is a need, then 2 days is good enough. Yeah, so monitoring workload is absolutely important. There is something which is called as motor sleeve. I don't know if you heard about it. A motor sleeve is used in baseball, which is almost like a sleeve which can measure the force that you apply. It's used in baseball, and the motor sleeve tells you how many throws have been done, what was the speed of the arm, what was the external rotation angle and degree. So that's something which is used. It's a bit expensive, but a cheaper technology similar to that might actually help, because counting the number of balls could be a very boring task.
Yeah.
But if there is an automated way of how that can be done, then that will surely be helpful.
I think that's what's really interesting about this is shoulder injuries, obviously in cricketers, as we said, are very common. A lot, like you said, 25 to 30% of players are probably having some form of non-time loss shoulder injury. And I don't know any cricketers that, one, would be able to tell you how much they've thrown in a week, two, would be able to tell you they've done a throwing session. It's just whenever the coach says we're going to do some fielding, you're going to throw, you don't know how much you're going to throw, you're just going to throw. And in a game also, you're not tracking how much you're throwing in a week. And I think cricketers are getting better if they're bowlers at tracking their workload, but I think they're still in general not really aware of how much they're actually bowling. But when it comes to throwing, no one has a clue, and it's trying to change or basically make cricketers aware that workload is very, very important to monitor. And if you don't monitor it and then you get pain, like it's not a coincidence.
Yeah. I mean, at an elite level, at a professional level, you do have dedicated people who can do that. You can use GPS not to monitor throwing, but you can actually measure their sprint velocity and then correlate that with, if it's bowling or whatever. Yeah. But at lower levels, you got to educate your player, you got to educate your coach that it is important to. It doesn't have to be accurate, but approximately, if you can estimate those things, then it is good for them on a long-term basis.
For sure.
Another thing, because if you're talking about high school cricketers, and then if you're talking about level cricketers, I don't know how it is in the UK, but in New Zealand, most cricket players, especially the fast bowlers who tend to be taller, play rugby during the off-season. And rugby is a high contact sport. And rugby has a very high prevalence of shoulder injuries. Yeah. And sometimes it is very hard for us to track down to say if the shoulder pain or the injury is purely cricket related, or is it something that they brought over from the off-season sport. Yeah. So, I mean, we can't really tell high school cricketers not to play any other sport during the off-season. But, again, educating the coach in New Zealand. It's quite important. Yeah. And one thing, as I said about number of throws, number of balls per session, and number of sessions per week is very important for recovery. So telling them how much time you need between sessions for your soft tissues to heal is very important. That again is an education that you got to give if needed. I mean, again, this is the same analogy I would give. If you're going to the gym and if you're working out a muscle group, you might do 2 sessions a week. 3 sessions is probably a bit too much for the same muscle group. And we're talking about large muscle groups. If you're loading your quadriceps, your gluteus maximus, your pectoralis major, big muscle groups, you might do 2 sessions max in a week. And then you would actually do one on a Monday, one on a Thursday, right? You have 2 days of recovery time. So think about it when you're looking at the shoulder. We are looking at a small muscle group called the rotator cuff. So if you're going to load it on day 1 and day 2 and day 3, surely you're going to inflame those muscle groups. So giving enough time between sessions so that the muscle can heal itself is a wise way of taking care of yourself.
Yeah, for sure.
So giving importance to recovery. And another thing is this is mainly for coaches, I would say. There is a subjective reporting of shoulder pain. It's called as the KJOC. It's called Kerlan Job Orthopedic Shoulder Score Calculator. Okay, it's called KJOC. If you just type for KJOC, shoulder and elbow score, you will get a survey. Have a look at that questionnaire.
Here we go. Cool. Yeah, I'll share my screen again. 2 seconds. Share.
Yeah, that's the one. Very good. Yeah, so that's subjective reporting of how you feel about your shoulder. Yeah. So even if you do this once a week, it's only 10 questions. It is a feedback for yourself on how your shoulder health is. And at the same time, if coaches can actually have a look at their players and then ask them to fill something like this, would actually help.
Yeah.
Awesome. And then you get a summary score. And this is widely used in research in clinical settings as well, this score. And this is very specifically related to the shoulder. Yeah. So having something like this on a mobile phone app and then asking your team to fill it out by the end of a training session, how did you feel? And then the coach could probably collect that information and just tell to. So the reason why I'm saying this is, as we spoke about it before, it's very hard to count the number of balls and number of throws you do every session. But if you can have a subjective reporting of something like this, then the coach could make a wise decision saying that, okay, it looks like you're not feeling 100% on your shoulder, so probably we'll reduce the workload in your shoulder. So just taking care of it is a wise option. Of course, you can do imaging tests and everything, but those are expensive. But this is a very easy way to take care of it.
Yeah, love that.
Yeah, so that's pretty much the what I would sum as the cricket shoulder first 11. How you take care of your shoulder. Yeah.
No, I think that's all super helpful, and I've definitely learnt stuff in there. So I'm sure the guys and girls watching will have learnt stuff as well. I think the key takeaways for me are the external rotation stuff over internal rotation. And thinking of throwing as basically doing the internal rotation strength for you, and then just like workload. It's so crucial whether you're throwing or you're bowling is keeping track of it. And you can have the best S&C program in the world, you can have the best pre-season, off-season in the world, but if you have a massive spike in workload, whatever you do, cricket or not cricket, you're going to increase your chance of injury.
Yeah.
So no, that's been super helpful, Sibi. Thank you. And because of time today, I think we'll wrap it up.
I'll just say one last thing.
Yeah.
So far, we have only spoken about overuse-related conditions on the shoulder because, as I mentioned before, in the shoulder you have a lot of non-time loss injuries. But we do have acute injuries happening on the shoulder. Now, that's mainly due to diving.
Yeah.
Now, if you look at a rugby try, when they go for the try, they put a lot of load, but they're being taught how to land.
Yeah.
Whereas that is not being taught or coached in cricket. How do you dive for the ball? How do you improve your agility and your flexibility, and how do you improve your body awareness? Is not being coached. Because it's not in the coaching circles, right? Unless you go at an elite level. But teaching and coaching a player how to dive, how to be a bit more agile on the field is very important, because that could minimize acute shoulder injuries.
Yeah.
Because no matter what we do, if you fall down and if you dislocate or do something to your shoulder, all the strength and conditioning or the workload monitoring, nothing is just going to help.
Yeah.
So from a coaching point of view, teaching proper throwing mechanics using the lower limb transfer of force, and then the question that you asked before, having 90 degrees of abduction when you're throwing is good. And even if you're going to be throwing this way, as long as your shoulder is above, that is good. So this is 90-degree shoulder abduction, and this is also 90-degree shoulder abduction. As long as your hand, your palm is above your head, that is a good throwing technique. It's just your trunk is changing, but you're still throwing this way. So the moment this drops down, that is bad, even from a standing position. And the moment the shoulder drops down, that's bad. So making sure that, so from a coaching point of view, throwing mechanics, teaching throwing mechanics is very important, and teaching diving is quite important for a coach as well. So to prevent and minimize the acute shoulder injuries.
Awesome. Yeah, and I think I can all instantly picture quite a few players that I play with who throw from there, and then do have shoulder issues. And so, I think definitely, and I'm sure most of our followers watching will have heard of athletic fielding, which is really, really good account in the UK, doing some really good work on kind of diving and rolling and teaching people how to field properly. So if anyone hasn't checked out Jack at Athletic Fielding, then go check that out. But like you say, if you don't practice it, then you're not gonna just naturally do it when you're diving at 100% in a game. But no, thank you very much, Sibi. And I'm sure if anyone has any questions or comments, if you leave them in the comments below, and I'll work with Sibi to get back to you. But for now, we shall say bye bye, and I'm going to stop this recording.